My name is Joshua Marcus. I'm a board-certified neurosurgeon here at Elite Brain and Spine of Connecticut. My specialties include minimally invasive spine surgery of the lumbar and cervical spines, as well as blood vessel disorders such as brain aneurysms and stroke. Chronic neck and chronic back pain are often some of the most challenging things we treat, and there's lots of available treatments, lots of modalities, surgery again being one of the last possible resorts, and in many instances, not even a real viable option. A lot of patients will ask, why do I have this neck and back pain? Where's it coming from? There's pain that, often in an overarching term comes from arthritis of the spine. Sometimes it's facet or joint mediated pain, right? Just like your knees or your hips can wear out, the joints of your spine can wear out. They're working hard in the neck, they're working hard in the back. They're mobile parts of our body, and so they work harder than what we call rigid bones or rigid structures of our body. And those joints have nerve fibers, and when those joints become inflamed or overworked, they hurt. And sometimes the same applies to the discs. The discs have nerve fibers, particularly in the back part of the disc. And when those discs wear out and there's not as much shock absorption between the two bones of your spine, it also causes pain. So neck and back pain is typically grouped into facet-mediated or joint pain, or disc-mediated or discogenic pain. We're happy to see patients at any point in the process. Sometimes we see patients when they've only had a day or two of pain. Sometimes we see patients who have had 20 years of pain and 5 surgeries. And anywhere in between is valuable time for us to evaluate and get involved in that patient's care. It's important to have a quarterback, right? Somebody who is coordinating all of the different people involved in their care, whether that be their physical therapist, their chiropractor, their pain physician, their primary care doctor. These are people we want to conference with on a regular basis to coordinate care, and the care of the spine and neurosurgical patient is complicated. Often we will start with some basic x-rays. Sometimes those x-rays are just pictures from the front, which we call AP x-rays, pictures from the side, which we call lateral x-rays. Sometimes we ask the patients to bend forwards and backwards to make sure there's no mobility or abnormal motion of the bones. We move on to some more advanced imaging tactics like MRI and CAT scan. Once patients either have failed a sort of short round of conservative treatment, or they have some very concerning pain or very concerning weakness or numbness, patients will come in and they'll say, I want an MRI. I think I need an MRI. I've had pain for a few days. And it's hard to tell patients, we're not going to get an MRI to start with. Sometimes insurance companies won't approve an MRI that early in the process. But oftentimes the conservative treatments that we offer, whether it be physical therapy, a round of anti-inflammatory medications, just rest and ice, is more than sufficient to make patients better, and they never need that MRI. We use MRIs and CAT scans when we need to. Sometimes they're extremely valuable for targeting additional treatment. I often won't send patients for things like injections, and obviously not for surgery unless we have all of the appropriate imaging we need. It's frustrating for patients to hear, we're not going to get an MRI yet, and hopefully talking them through that process and sort of why these conservative treatments need to be explored before an MRI. And most importantly, even with this MRI, it may not change what we're going to do in the next 2 to 4 weeks. Of course, if something worsens or something becomes more bothersome, we bump that timeline up, right? And the MRI gets done pretty quickly. Sometimes we start with x-rays though. Once again, I'm Dr. Joshua Marcus. If you or a loved one are experiencing any of the symptoms we spoke about, please feel free to reach out to Elite Brain and Spine. We are happy to help.